And good evening. The breaking news from the Middle East tonight. New fighting between the U.S. and Iran. 3 U.S. destroyers faced multiple attacks near the Strait of Hormuz. We have new reporting on that in just a moment. But we're going to begin with a worrying new challenge in efforts to contain the hantavirus. The epicenter of that outbreak, with 5 confirmed cases and 3 dead, is that luxury cruise ship now en route to a controversial docking along Spain's Canary Islands. Nearly 150 people still on board. All are potentially exposed to that deadly virus. But the ship also confirmed today that after the first passenger fell ill and died before the cause was known, dozens of passengers got off the boat and went home, including back here to this country. Health officials are now tracking at least a half dozen people across 5 states. Tom Hanson is on this again for us tonight and joins us now. Tom, good evening.
Tony, good evening to you. Those Americans are not reporting any symptoms so far. Nonetheless, the CDC taking this very seriously, working with the WHO and State Department to monitor those passengers who have returned home.
After a full day of sailing, the hantavirus-stricken MV Hondius is slowly closing in on its destination, about 600 nautical miles away from Spain's Canary Islands. Tenerife may be the intended destination, but officials there aren't rolling out a welcome mat, saying the Dutch expedition cruise liner cannot dock there and must remain offshore when it arrives this weekend. Port workers there say they're worried because they haven't been given any information about safety measures. The move is raising new questions about whether the nearly 150 passengers currently isolated in their cabins will be forced to remain at sea for up to 2 months as they wait out the quarantine period of a rare form of the virus called the Andes strain. This Turkish passenger says she hopes to get home as soon as possible. Today, the World Health Organization said no one else on board is currently symptomatic. 3 passengers, including the ship's doctor, were evacuated off the Hondius yesterday. The Dutch Foreign Ministry now says all 3 are receiving specialized medical treatment in Europe. Meanwhile, the cruise operator says nearly 30 passengers from at least 12 countries, including 6 Americans, left the ship without contact tracing during one of its first port stops in St. Helena before the hantavirus was suspected. Now, global health officials are scrambling to track them all. State authorities say 1 passenger is now home in Arizona, another in Virginia, 2 in Georgia, 2 in Texas, and an unknown number are back in California.
It felt as if my brain was melting. It does feel like something standing on your chest. In a way.
After spending 2 weeks on a ventilator in the hospital, Cam Dockery survived his battle with hantavirus back in 2005.
I would not wish this on anyone.
And health officials say the risk to the public remains low, but how soon they can get those passengers off the ship is up for debate, Tony.
All right, Tom, thank you very much. We are, as you might imagine, getting a lot of questions about the hantavirus, so we've asked our chief medical correspondent, Dr. Jon LaPook, to join us. Dr. LaPook, thank you very much for being here. You've got all these Americans still on board the ship. How do we get them home?
You know, I spoke this afternoon with somebody with knowledge about what's going on at the CDC, and I was very happy to hear that there's close collaboration with the World Health Organization, with our State Department, and with state health departments. So they're talking right now about the State Department maybe having a 747 that's equipped with pods, with these capsules where, you know, people being transported back, if they happen to get symptomatic, they can go in there and be safely there without infecting other people.
Okay, transported back. What happens when they get into the U.S. again?
Right. A lot of questions, right? So what does it mean if you were exposed? We know the incubation period's up to 6 weeks about. So are they allowed to go outside? What does it mean in terms of monitoring yourself? And I've heard that they're considering talking to people about daily temperatures, about staying away from large crowds. But I also heard that there's going to be some more formal advice within the next 24 hours or so for the public.
Bottom line, doctor, how worried should people be?
The World Health Organization said today that the risk to the general public is low. Now, I know that's going to be triggering for some people who are thinking, oh, we were told that, you know, with COVID. But remember that the virus that caused COVID was one that we had never seen before. This one we've known for 30 years. We know how it's spread when it is spread from person to person. It's with close contact.
So it's not as easily caught by other people.
It's not as easily caught with other people. Now, remember, we still kind of at the beginning of this. There's an asterisk because there may have been people exposed who, because of the long incubation period of 6 weeks. But for now, the risk to the general public is low. Always, we keep our minds open, we stay humble. If things change, we will let everybody know.
Dr. LaPook, thank you very much.